Welcome to Bodybuilding World. Our mission is to improve the safety of bodybuilding with or without hormone replacement therapy. We are committed to changing the world's perspective on bodybuilding by educating our community in order to achieve safe and effective results.
Obtaining a comprehensive hormone panel prior to starting TRT. The following hormone panel is recommended: total testosterone, free testosterone, sex hormone binding globulin, SHBG, estradiol, prolactin, LH, luteinizing hormone, FSH, follicle stimulating hormone, PSA, prostate-specific antigen, CMP, comprehensive metabolic panel, CBC. What does estradiol tell us? Estradiol is one of the main sex hormones, and although it is often thought of as a female hormone, it plays an important role in male health as well. Estradiol is produced in the testes and adrenal glands and is converted from testosterone. Estradiol has a number of important functions in men, including: estradiol helps to maintain bone density and reduce the risk of osteoporosis. It plays a role in sex drive and libido. It is necessary for the production of sperm. It helps to stimulate the production of red blood cells. It may play a role in mood regulation. It may play a role in cognitive function and memory. In men, estradiol levels are typically much lower than in women. However, estradiol levels can become elevated in men due to a number of factors, such as obesity, liver disease, and certain medications. High estradiol levels in men can lead to a number of problems, including gynecomastia, breast enlargement, decreased sex drive, and erectile dysfunction. What does prolactin tell us? High prolactin levels in men can lead to a number of problems, including decreased sex drive, erectile dysfunction, and infertility. Elevated prolactin leads to gynecomastia. What does LH and FSH tell us? Prior to starting TRT, LH and FSH levels are measured to determine the cause of low testosterone levels. If LH and FSH levels are high, it suggests that the testes are not producing enough testosterone. In other words, they're receiving the appropriate signal from the brain but the testicles are shut down. This is called primary hypogonadism. If LH and FSH levels are low, it suggests that the pituitary gland is not producing enough LH and FSH. This is called secondary hypogonadism. Secondary hypogonadism occurs in long-term testosterone users and abusers of anabolic steroids. Measuring LH and FSH levels can also help to determine if a man is responding to TRT. If LH and FSH levels decrease after starting TRT, it suggests that the hypothalamic pituitary axis is intact and the testes are shutting down appropriately. The suppression can occur with as little as 50 mg of testosterone per week. What does PSA tell us? Prostate-specific antigen, PSA, is a protein produced by the prostate gland. PSA levels are typically low in men, but they can increase due to a number of factors, including prostate cancer, prostatitis, and an enlarged prostate. PSA is measured prior to TRT to assess the risk of prostate cancer. TRT can increase PSA levels, so it is important to establish a baseline PSA level prior to starting TRT. This will help to determine if any increase in PSA levels is due to TRT or to prostate cancer. Why is a complete metabolic panel, CMP, ordered prior to TRT? A comprehensive metabolic panel, CMP, is a blood test that measures the levels of 14 different substances, including electrolytes, minerals, and proteins. A CMP can help to determine how well a person's kidneys, liver, and other organs are functioning. The kidneys are especially important to assess. If TRT causes elevated blood pressure, it can have a deleterious effect on kidneys. The liver is also important to assess, as it is a vital organ in overall health. Why would CBC, or complete blood count, be measured? CBC is very important as oftentimes TRT can lead to increased erythropoiesis. This means elevated red blood cell count, which can thicken the blood and increase the risk of blood clots. CBC can also help to diagnose hypogonadism, the condition of low testosterone. A CBC can help to identify any underlying medical conditions that may be contributing to hypogonadism, such as anemia, kidney disease, or liver disease. The cutoff for testosterone levels for TRT treatment is 300 nanograms per deciliter total testosterone. However, this is just a general guideline. Some men may benefit from TRT with testosterone levels above 300, while others may not experience any benefit from TRT even with testosterone levels below 300. Oftentimes, free testosterone levels and SHBG are also taken into consideration. 300 is a generalization and a rule that is appropriate for most TRT users. Ultimately, the decision of whether or not to start TRT should be made on a case-by-case basis, taking into account the individual's testosterone levels, symptoms, and overall health. Fertility is certainly an important consideration and it should be discussed with the patient prior to starting TRT. Here are some factors that may influence the decision to start TRT. Symptoms: the presence and severity of symptoms associated with low testosterone, such as fatigue, decreased libido, and erectile dysfunction. Testosterone levels should be measured on 2 separate occasions to confirm that they are consistently low. Overall health: the presence of any underlying medical conditions, such as obesity, diabetes, or heart disease.